First item on tonight's agenda is the consent agenda. May I please have a motion to approve the consent agenda as presented?
So moved.
Second.
Comments or discussion from the board? All those in favor?
Aye.
Those opposed? So moved. Olympic Medical Physicians Report, Dr. Corley.
Good evening. I'm here to request approval of the physician employment contract for an OBGYN physician, Oksana Sholonka, MD. She is, Oksana was raised in the Ukraine. She practiced OBGYN there as a physician for 10 years before meeting her American citizen husband and moved here to the United States with him. She then turned around and repeated a 4-year OBGYN training program in order to practice medicine in this country, and she's currently in her 4th year. She's at New York Medical College back in New Jersey. No wonder she wants to move to the West Coast. I talked to one of her attendings this morning, and she described her as one of the best residents they'd ever seen. And she's the person that if anyone needed extra help or to stay late in the evening to help out with something, she was the person that would volunteer to do that. She also described her as having a special talent of working with the difficult pregnant women that may be runaways and on the street or have drug issues. So it was really delightful to hear some really nice things about a physician that you've met and really enjoyed. So she interviewed here about a month ago, and everyone who met her loved her. I believe an ad that her husband and son went swimming in Lake Crescent in late October. This is our, she would not be able to join us until the summer of 2016 because, as I say, she's finishing her residency. This is our standard physician employment contract. It is for a base salary of $308,368. It does include a $12,500 fellowship stipend, and then a $12,500 signing bonus when she completes all her paperwork. It includes our standard benefits, CME of $4,000, and then a retention of $10,000 a year for 4 years.
May I please have a motion to approve the OMP OBGYN physician employment agreement for Oksana Sholonka, MD, at the annual salary of $308,368 as presented.
Second.
Comments or discussion from the board? All those in favor?
Aye.
Or she will have because her husband is an American.
Can you repeat that, please, Jim?
She is a U.S. citizen.
Yeah.
Thank you.
Yeah, she's a U.S. citizen right now.
Other comments from the board or discussion? All those in favor?
Aye.
Those opposed? So moved.
Great, thank you.
Thank you, Dr. Corley.
I would also like to introduce the contract for Jennifer Hunter. She is an ARNP who is a recent graduate of Seattle University. I will bring you more information at the next meeting. She will be joining the pulmonary team as an ARNP, and this will be for a base salary of $90,000. Thank you.
Thank you. I don't think there's anybody in the public sheet, Jane. Okay. Next up is old business. Eric Lewis, Chief Executive Officer, 2016 to 2018 strategic plan.
Well, good evening. Tonight I want to bring forward for board consideration the 2016-2018 strategic plan. We introduced that at the last board meeting, November 4th. We only have one change since then. And the one change we have is on page 1, the board letter to the community. Under our vision, the third paragraph, the first part stays the same, where it says the community will benefit from Olympic Medical Center's local focus as it addresses the healthcare needs of our citizens. And then we changed it a little bit to add the triple aim, where it says, through focusing on the triple aim of improving individual patient experiences, improving our community's health while maintaining financial stewardship. And I think the triple aim is the governor's plan for the state, and we've long talked about improving individual patient care, improving population health, and controlling per capita spending. So I think the board strategic planning committee was comfortable adding that one little phrase. So that's the only change for what you saw 2 weeks ago. I will say that this is a living document. This is a document that we use every day. I carry it around with me, and as we make decisions, it does drive our decisions and how I try to spend my time and other people in the organization spend their time. We update it at least annually, but the board can update it more often if necessary. And I think the environment we're in healthcare, we have to be ready to change our strategic plan if the rules change in DC or Olympia. I do want to recognize, the entire board involvement in this. The board is really involved in strategic planning, which is very helpful. The board strategic planning committee spent a lot of time. That's Commissioners Oblock, Commissioner Hordijk, and Commissioner Beitzel. All three spent a lot of time on this. Bobby Beeman helped us with drafting. And alt, employees, medical staff. We had medical staff meetings in both Sequim and Port Angeles. And public input. Really, it all comes together in these changes. And I will say, probably one of the biggest changes we made this year is the first page, the board's letter to the community. We talk about our core values of quality, teamwork, compassion, respect, integrity, and stewardship. We give a little bit of an explanation on each one, which I think is very helpful. We also updated our vision and where we're going, where we want to be 5-10 years from now. And I thought that was very key work. The big new goals we have a total of 29 goals. The new goals that are they're I think pretty big is one is we're implementing a quality management system, and this will use ISO 9001 through DMV. We'll be certified by 2017. That is a big goal. We've been working on it rather extensively the last 6-7 months, but we're going to keep working on it through 2016. We also have added a goal on becoming DMV infection prevention and control certified by the end of 2017. It's a 2-year process to become certified. We are working on it now. This will affect every department at Olympic Medical Center. It will affect our medical staff, and just making sure we're having the best practices, the best processes on infection prevention and control. So I think that's a very good goal. We'll also be evaluating whether Olympic Medical Center should become a 49-bed sole community hospital with rural health clinics. That'll be evaluated over the next 6 months. We'll come back to the board with a formal report. We also are going to be implementing Honoring Choices Pacific Northwest. OMC is one of 30 hospitals receiving a grant. And what this is it's an advanced care planning program where people make their they do advanced directives, they make their wishes known, and get those documented on an advanced directive. We're going to be doing that in 2016 at all of our clinics, a lot of education, a lot of process improvement. We're also going to be working on implementing inpatient palliative care program with hospice beds here at Olympic Medical Center. By 2017 will be implemented, but we're going to start this year. The other thing we heard loud and clear from the medical staff is we need a pain management program. We're going to start implementing that this year. By 2017, we want to have a full program. We really need the new building to be completed because we're going to need that space. But other than that, I think the focuses of the strategic plan will remain the same. We want to continue to move quality, patient satisfaction, and safety forward and improve in those areas. We will continue our advocacy work. We need to be with 83% of our patients paid for by either federal or state programs, Medicare, Medicaid being most of it. We need to be involved in advocacy, continue to move the Swedish affiliation forward, and try to get more local services, particularly in cardiology, neurology. We're going to work on OMC operational excellence, which is about reducing wait times, increasing access as one goal. Second goal of increasing patient satisfaction, and the third goal of improving employee satisfaction and engagement. So we got a lot of work to do there. Every department will have goals in those 3 areas. We'll have overall goals in those 3 areas. We'll continue to work with the medical staff and recruiting the physicians we need, with a major focus on primary care. And as far as specialty care, we're going to focus on psychiatry, working with behavioral health, rheumatology, OBGYN, which the board just approved one, but we only had one OBGYN, we need to get to 3. So being at 2 is much better. We still have more work to do. Pulmonology, orthopedic surgery, cardiology, oncology, and gastroenterology. So a lot of recruitment. We'll also be working on a rural family medicine residency program with Swedish and North Olympic Healthcare Network. The medical office building here in Port Angeles will be a major focus next year, along with staying financially viable. That's a quick summary of the plan. I don't know if there's any questions or if any committee members want to add to that. Any questions about the strategic plan?
May I please have a motion to approve the 2016 to 2018 strategic plan as presented?
So moved.
Comments or discussion from the board? All those in favor?
Aye.
Those opposed? So moved. Eric, please stay up there for resolution 490 declaring substantial need to increase the tax levy.
Yes, our CFO, Julie Ruckstaff, couldn't make it this evening, so I will fill in for her. Resolution 490 is a resolution declaring substantial need for a 1% tax levy increase. And really the need is around reimbursement at the federal and state level for Medicare and Medicaid has gone down. At the same time, our costs on things like wages, equipment, pharmaceuticals, and supplies have gone up. And we believe we have a substantial need for a 1% increase in the tax levy.
May I please have a motion to approve resolution 490 declaring substantial need to increase the district's tax levy by 1% as presented?
So moved. Second.
Comments or discussion from the board? All those in favor?
Aye.
Those opposed? So moved. Eric, resolution 491.
And Resolution 491 basically raises our tax levy by 1%, which is $39,698. It authorizes the 1% increase, and we will give this to the Clallam County.
May I please have a motion to approve resolution 491 increasing the district's tax levy by 1% as presented?
So moved. Second.
Comments or discussion from the board? Those in favor?
Aye.
One quick comment. Somebody want to check the numbering of those resolutions? Half that I have is 492. This one was 490.
That's the next one, Jim. 492 is the budget, adopting the budget.
Okay, I'm sorry.
Not a problem.
One paper here on the little table.
It's okay. Other comments or discussion from the board regarding resolution 491? Those in favor?
Aye.
Those opposed? So moved. Resolution 492, adopting the 2016 budget.
Yes, the budget remained the same from what we presented 2 weeks ago at the public hearing. Resolution 492 adopts the operating and capital budget. I will say the operating budget and capital budget are really driven by the strategic plan. So we have the things in the strategic plan, like implementing a palliative care program at the hospital, we have money budgeted to do that. Both operating and capital, we try to make sure that the strategic plan directs us on where to spend our money and what our priorities are. So I think that the budget is a good plan. We are, wages are going up, and we did have to remain market competitive on wages. And unfortunately, Medicare reimbursement is not going up. About 60% of our reimbursement is Medicare, and Medicare is, so the contractuals have gone up on Medicare. So I think the margin we're projecting is about almost 3% margin, which is really our long-term goal. We want to make, we're a nonprofit public hospital, but we need to make a small 3% margin over time. So one, we can invest in capital. 2, we can pay the principal on our debt. And we have to do those things to remain viable. And I think we're focusing on making sure our financial situation is solid for the coming 5 and 10 years. And it does require us to make the right decisions. On the capital budget side, we have a substantial capital budget due to construction, and primarily the Port Angeles Medical Office Building.
Yep. May I please have a motion to approve resolution 492, adopting the 2016 budget as presented?
Second.
Comments or discussion from the board?
Just want to thank the staff for doing a great job on the budget. It's a lot of hard work, and the budget committee level certainly saw a lot of work done, and congratulations on your stuff.
Yeah, I really think the whole organization worked hard on it, but in particular the finance department, led by Julie and Roxette and her team. They assign, every cost center gets assigned a financial financial partner, and there's substantial teamwork across operations, clinical and financial, to come up with the best possible budget. And I'm very impressed by the process, and I think it went very well, and they worked really hard on it.
Other comments or discussion from the board? All those in favor?
Aye.
Those opposed? So moved. Routine contracts included in the 2016 operating budget, Eric?
Yes, on page 46 of the board package, there's a listing of those contracts, and these are all contracts that are existing that will renew in the coming year. Most of them at no increase or very modest increases. I think the one thing I do want to point out, the budget committee did go through all these in detail. We did talk about it 2 weeks ago, but we are continuing our free clinic support. I think that's been a major focus for us, and I think we're supporting VMO with free lab and x-ray to the tune of a little over $80,000, $58,000 for psychiatric care and medications, $58,800 for that, oral health, $18,900, and then we're a total of $158,550 that we're supporting VMO. We're also supporting Dungeness Valley Health and Wellness Clinic and Swim, lab and x-ray of $110,250, oral health program $18,900 for a total of $129,150. So those two together are about $280,000, and we provide as much help as we can to make sure those free clinics, because there are still people uninsured that have no access to care without these free clinics. And there's a lot of volunteers. They leverage their money, I think, about 3 to 1, or maybe even more, as far as a donation. For $1 donation, they can provide an amazing amount of care because of donated physician time and RN time.
It used to be 5 to 1. I don't know what it is.
I think 5 to 1 is the right ratio. It's a tremendous leverage of money, so we will continue to work with VMO and Dungeness Valley Health and Wellness Clinic in this budget.
May I please have a motion to approve the routine contracts included in the 2016 operating budget as presented?
So moved. Second.
Comments or discussion?
I just wanted to point out that, to the best of my knowledge, which is not really up to date, the fact that there's no psychiatric care shown for Dungeness Valley Health and Wellness Clinic is because they go through the VMO program.
That is true. I think the two free clinics do try to work together, and we've centralized the help on psychiatric at VMO. And many OMC employees volunteer at both these organizations. So I think it's a good community effort to keep these services available for the uninsured.
Other comments, Jean?
I just have, I noticed this the other day, and it just says, under the current contract expiration date, it says for the clinics that it expired in 14.
That's a typo.
I was hoping.
We do annual contracts, and those both those should be 15. So they do expire at 12/31/15. So we got to get new contracts in place before year end. But I noticed that too. Thank you for noticing.
Other comments?
Yeah, I just got a historical word. I remember when the passage of the Affordable Care Act, well, we're not going to need it, and some of us said, no, you're going to need it because there are going to be people still that are going to fall through the cracks. And here it is, we have Affordable Care Act, and we still have people that are uninsured and need care. So that's why we continue.
Yeah, that's a very good point. I mean, if you look at the Affordable Care Act, there were about 50 million uninsured Americans. And since it was implemented, about 16 million of those have found coverage. So about a third of them. So there's still 34 million uninsured Americans. But if you look at Clallam County, we were probably at 11, 12,000 uninsured. And, maybe 4,000 or something, heading towards 5,000, have been able to find insurance through the Affordable Care Act, either through Medicaid or through the exchange. But there are many people that still cannot get coverage. They can't afford it through the exchange, and they can't qualify for Medicaid. So there's still a substantial number of Clallam County residents without insurance.
I know that in SWIM there are a lot of people, not a lot of people, of the people who are eligible for the care. There are those who can't get everything done very quickly, and so in the meantime they might happen to get sick.
Yeah.
And that's where this safety net enters.
Yeah, I think.
And then there's people who simply can't afford them.
Yeah. I think 16 million Americans suddenly became covered. To train a primary care physician, it takes over a decade. So we have an intense primary care shortage, not only across the nation, but in Clallam County. And if you don't have a primary care home, or if you have a $5,000 deductible, and you're sick, you need help, you need care today. And quite frankly, these patients would wind up in a very busy and expensive ER if we didn't have appropriate community-free clinics. So one of the huge benefits to Olympic Medical Center in supporting these clinics is we allow people to get the care they need without further congesting a very expensive resource, and that's our emergency room.
Other comments?
My understanding is that there was a retired physician that was interested in becoming the director for demo, maybe giving Dr. Hoffner a few years of retirement. And I don't know, has anything come to your desk on that, Eric?
I believe that has happened or is happening, yes.
Thank you.
I think VMO's doing a lot of things, and actually this weekend on Saturday I was at a retreat for the Dungeons Valley Health and Wellness Clinic, and they're moving forward very nicely too. So I think both free clinics are strong and moving forward. Although it's very challenging because their budgets rely on annual fundraising to continue to do what they do. So the boards have to be diligent.
Other comments from the board? All those in favor?
Aye.
Those opposed? So moved.
Thank you.
Award for the bid for the CT remodel project?
Yes, I got a presentation now. I have very good news. We have bought a state-of-the-art Siemens CAT scan unit that is water-cooled and wide bore, and we're very excited to get it installed. We went out to bid, and we got bids yesterday. And the low bidder was Kirtley Cole, which, as the board knows, is the same contractor we're using for the medical office building. So they've proven to be a very good contractor. So we're very excited to say that Kirtley Cole was the low bidder at $614,000. Our engineering estimate was $600,000, so they're right there. We did do a not to exceed at $750 to give us some leeway. We got two other bids, one for $628, one for $626. One of those bids actually didn't count because of the weather yesterday. One of the contractors could not get across the Hood Canal Bridge, so the bid came in late. But it doesn't really matter because they were slightly below Kirtley Cole bid. But having three bids in the same range gives us pretty good comfort that it's a competitive, good bid. So we are excited to recommend approval of the lowest responsible bidder, which is Kirtley Cole. at $614,000.
May I please have a motion to award the bid for the CT remodel project to Kirtley Cole Associates LLC at the total cost of $614,000 as presented.
Second.
Comments or discussion from the board? Jean?
When's this gonna start and how long?
Great question. I will say that we'll give the notice to proceed probably tomorrow. It will take a few weeks to mobilize. And how long a project is it, Daryl? 3 or 4 months?
Yes, that's the hope, yeah.
It's a complex problem, a lot of electrical, mechanical, and plus we have to, as we remodel the room and the area, we have to bring the CT in, get it installed. But I think by early spring, it should be operational. This will give us two CAT scans at the hospital, which has been our long-standing goal. John Trollia, our director of diagnostic imaging, is here, and I think he's leading this way, and it's going to be very good for the hospital.
All I can comment is the sooner the better.
I agree, Jim.
Other comments from the board? All those in favor?
Aye.
Aye.
Those opposed? So moved. Eric, the administrator's report.
Yes, I just want to give a quick update on the Port Angeles Medical Office Building construction. CenturyLink work is basically completed. It is about 3 weeks behind schedule, but that does slow us down some. We will try to make it up, but we're not, that just did not happen as quickly as we had hoped or planned. And then the soil conditions in the basement for the footings is another area of delay. The soil has not been compacted the way we need it, so there is a substantial change order for additional work in process. We don't know exactly how much it's going to be, but basically a bunch of additional dirt had to be removed and chipped away, and then rock and other rock had to come in to replace it. We think what the contractors told us, rough order of magnitude of $175,000. That situation is being worked on every day, but it has slowed us down by a few weeks. The weather has not helped us either, because our basement has been filling up with water, and we have to, as part of the soil conditions, there was groundwater in the soil, so it's been very complex to get because we need to get the footings, of course, completely right. So that will probably, at the next board meeting, bring back a change order to the board if we can get it finalized. But it's looking to be in the range of $175,000. The next steps on this building.
Before we move on, can I just ask on this, the new soil and rock footing that you need, is it going to require pilings by any chance?
No, Jim, what they're having to do is excavate about 3 inches or 3 feet down, and then they have to build an 18-inch base of rock instead of the initially planned 4-inch base of rock, just because of the soil there. So they're not going to have to actually do pilings. But what that'll do is create a large area where they can actually pour the walls and do what they need to do on top of that. So they're not going to have to go any deeper.
So the soil underneath after this level is good
Correct.
and solid.
Yeah,
afterwards.
exactly.
Okay.
Yeah.
They were to dig down to top to solid soil, and then 18 inches of rock, which I think we had planned to put 4 inches of rock.
Correct.
But the big next steps, we really are putting in the footings for the building and the basement walls and floor, pouring concrete and steel. That's the big next step, and we've got a window of good weather, hopefully, and we're going to move on that aggressively. And some people are very excited about stage 2 demolition. The women's clinic building, the women's clinic building life expectancy is about a week and a half. It's coming down, which there will be midwives at this facility, very happy because they're concerned that I might put them back in that space. But it's going to get done. The old home health building and the old IT house will get torn down. So it'll be very nice to get that demolition done. And then they're really working hard on the 2 lots to the west of the hospital. Those should be paved and completed by the middle of December. So they're making progress. I think we have a good contractor. Our architect and Gerald Wolf and the team here at OMC is working really well with Curtly Cole. But there, there's definitely been soil challenges in this project. Any other questions on the Port Angeles Medical Office Building? Next, I just want to update the board on inpatient psychiatry coverage. We've long had an agreement with Peninsula Behavioral Health to have Dr. Josh Jones and other providers at Peninsula Behavioral Health come and do inpatient consults. We're working with them to expand that coverage. Really, we're looking at getting daily coverage here at the hospital from a psychiatrist. And it's needed not only in the inpatient floors, but also in the ER. And so we would have a psychiatrist cover the hospital every day and round on appropriate patients with a focus on making sure we're providing the best possible clinical care to patients with medical and mental health issues, or if we have any ITA patients, helping us with those. And there will be a focus on employee safety. We're working on the details. We are assisting Peninsula Behavioral Health recruit and a psychiatrist to make this all possible. And we've got some progress there, but the plan is at the next board meeting to bring a formal contract to introduce it to the board. And then potentially as early as December 16th, the second meeting in December, ask the board for approval. And start this as early as January of 16. Because the psychiatry coverage will really help us give the best possible care to patients with mental health needs. So this is a big new deal, and I'm excited about it.
I got a question. In the news they had, I think it was Evergreen Hospital, where they released a patient, and just as soon as they released him, that patient went out and stabbed 1, 2, or 3 people. So it sounded to me like it was somebody that had some problems on him. Where does the hospital fit in the responsibility picture on something like this? I was thinking for us, because I know we have ITAs here,
Well,
and we release them.
ITA really means it's the Involuntary Treatment Act, and then, obviously, we live in a country with personal rights and freedom. People can come and go as they want. So if somebody came and they were not an ITA patient, they could leave our emergency room. But if we feel they're a threat to themselves or others, we will call in mental health professionals from Peninsula Behavioral Health who can place an immediate ITA, so then they can't leave. And it gets very complex. I think the biggest problem our state has is we have a huge shortage of inpatient psych beds. The state has systematically cut back funding in that area, and I think we rank 49th out of 50 states on the number of psych beds per 1,000 residents. And sometimes we're unable to get the patient in the right setting, because we are not a psych hospital, and us keeping ITA patients is a big challenge for us. If they have medical needs, we can deal with that, and we get people with medical and psych needs all the time, but it's just psychiatric needs. We need more inpatient beds. That's something the Washington State Hospital Association has been advocating, and we've been advocating for years. It does get very complex.
Can I ask a question, please?
Yes.
Could we possibly have an update sometime from Behavioral Health on the status of the beds that we help finance that are, I realize, not institutionalized beds, but are the 3-day bed type things? What is their utilization? Are they being used? Is it working, that type of thing? And just invite Peter to come back.
Yes, actually, Peter and I have been talking about this, and just today I was talking with Galen. We're either going to have him come December 16th or the first meeting in January. So I think the respite beds that have opened up have been a huge success.
Thank you.
We've been able to divert many people that would have come to our emergency room and perhaps become ITA patients and been admitted to the hospital. They have gone to the respite center, and it's been very successful. Not quite as busy as we anticipated, but he will impress you. I can't remember the exact number of how many patients we've avoided having to go to the emergency room through the community respite beds. And I agree, Jim, and we'll get him scheduled and get him here in the next month or month and a half to give us an update on that.
Thank you very much.
Okay. Now I'd like to move on to new business. I want to introduce 2 contracts for approval probably on December 2nd, next board meeting. The first one is a radiation oncology locums agreement. We have a locums agreement with Dr. Lau. And we currently have a contract with him, but it has a not to exceed of $49,000. He's really good. We're impressed by him, so we want to use him potentially more in 2016 because we don't know exactly when. We're going to recruit another radiation oncologist full-time as an employee. So this agreement allows us to continue to use him, and it also adds he will do 24-hour coverage for radiation oncology at $200 per day. And this locums contract is for $1,400 a day plus lodging and travel expenses, and we'll use them as needed. But I think he's a very good resource. Staff, I think he's really a good radiation oncologist, so we want to expand using him in the future. And he's currently working at the Cancer Center. So I'll bring that forward at the next meeting. So if there's any questions in the meantime, let us know. If there are any questions now, or but I think this is a very cost-effective, good contract for us. And we want to try him for a while, and we are sufficiently impressed that we would like to be able to use them as needed through 2016. The second contract is an ongoing team member. It's a medical oncology professional services agreement. We have Dr. Kurt Norman, who works 2 days a week. He works Mondays and Fridays for us. He works part-time. He's done this for quite a while. He's part of the team of Drs. Cummett and Shariath, and they both work full-time, but he really helps out working Mondays and Fridays. Seem to be real busy days. He also helps cover for vacations. This agreement also provides he will do 24 hours of coverage for $200. He's really an important member of the team. His contract doesn't expire until April or May of 16, but we really want to keep him on our team because he was kind of asking if we wanted to keep him, and we said yes. We really want to. Patients and staff really appreciate having him. We want to send the right message. Renewing his contract way before, but we want to renew it for 1 more year beyond April of 16 to April of 17. We do pay for professional liability, and it costs $2,300 a day, but he does pay for all his own travel, lodging, meals, and benefits. And he just does a great job for us, and I've talked to some of his patients who are very pleased with his care. I just want to introduce this tonight and bring it back on December 2nd.
Where's he from anyway?
He lives in Tacoma, and you know, he's willing to commute here, and he just does a great job. And before he goes home, he always makes sure that he's helping out the other doctors. So he drives from Tacoma every Monday and Friday, and he enjoys being there. And he's an epic expert. He's worked for Group Health and I think Multi-Care, which also uses Epic, so he's got a lot of experience.
Diagnostic imaging equipment?
Yeah, diagnostic imaging equipment. Zeem, we have a need for a CR X-ray unit, and we've looked at, and Zeem is the recommendation from the committee. The operating room uses these portable CR X-ray, and we had a task force look at this. They looked at a number of vendors, but Zeem seemed to be what we liked technically, and thought it was the best choice. Commissioner Tom Oblock was on the task force, and maybe he can give us few words after I finish introducing or talking about it again. It's replacing a current C-arm that is approaching end of life. And really, surgery needs to have 2 of these because we have 4 operating general surgery and orthopedic procedure going on. We really need to have 2. The price we've negotiated, we're very pleased with at $131,800 plus sales tax. The asking price was $180,000. We budgeted $331,000 for it this year. And they gave us an extra $5,000 off if we completed it by November 30th. So I do want to bring it today for board consideration. The maintenance costs are $8,450 a year annually for 5 years. We have a 5-year agreement on maintenance. And this is a good piece of equipment, and our technologists, I think, are recommending it. I don't know if, Tom, if you want to add anything. Or...
I just continue to be impressed by our capital purchase process here at the hospital. I sat in on the demonstrations. John and Lisa asked all the right questions, and I feel very confident that we're getting the best equipment for the lowest price.
Yeah, and I want to compliment John Trolia for the way he brings in our techs into the process, the radiologists, finance, legal, even lets administration come once in a while. And the board's always invited. So I think it's a good team effort as we look at these, but particularly focus on the technicians and the radiologists, making sure we're getting equipment that will meet their needs and be the best for our patients.
John, please pass my thanks on to Lisa as well.
I will do that.
I'd like to make a motion to approve the purchase of the Zeeb C-arm X-ray unit at the cost of $131,800 plus sales tax and a 5-year maintenance for $8,415 annually as presented.
So, second.
Comments from the board? Discussion?
When are we gonna get this one?
I don't know, John.
They were talking 2 to 3 weeks.
Pardon me?
2 to 3 weeks.
Oh, okay.
It's a fairly fast process because it's a portable unit that's used in the operating rooms.
Other questions?
So, but if we have 2, is this the same as one we already have, or?
We have one that's a little smaller imaging intensifier, but it's exactly like what we had. And so that was we were kind of going between GE and the Zine product. It was pretty tight, but the technology in Zine, they really liked that a lot more, and they did some good research on why they liked it and wanted to go that direction.
Other questions? All those in favor?
Aye.
Those opposed? So moved.
Okay, the last thing I have, I just want to let the board know that we have a task force currently working on a year-end purchases. Sometimes vendors give really good pricing at year-end. So we're looking at 2 potential purchases in the budget that the board approved. The largest capital item is actually 6 new ultrasound units. Our current ultrasound units are 9 years old. It's time to replace them. Yes, we do. So these 6 ultrasound units, they're included in the 2016 budget. If we can get the right pricing and the right product, we're looking at we're looking at GE, Philips, what's the other vendor? Siemens. So we're looking at 3 vendors, and we're saying really impress us with pricing, and we might consider it by year end. So that's being worked on. Tom Olblock is part of that team. Our ultrasound techs are really heavily involved. The ergonomics is impressive. These machines weigh so much less. I actually went to radiology, our diagnostic image today, and pushed them around. And it makes a big difference having something that's ergonomically configured for people, plus easy to push around. Because we're always moving these ultrasounds up to the floors, down to ICU to do inpatients in their rooms. So that purchase is a potential purchase. We may introduce something at the next board meeting for action on December 16th if we feel we have got the right product at the right price. Also, in the 2015 budget, we had an MRI upgrade, and we are looking at really doing it right and upgrading both the SQUIM and the Port Angeles MRIs. The SQUIM one will be a larger upgrade because it'll be more hardware involved, but we'll get them both to the same platform. They're both GE MRIs, but we'll get the software to the same, and we'll get the hardware to the same on both of them. Is that right? That's my understanding. And this is a these two upgrades together are in the $1 million range, maybe a little bit less. It's a big upgrade. But we budgeted for it this year, and I think we really want to take a hard look at that. So these, we're looking at a package deal from vendors. Obviously, the MRI upgrade has to come from GE, since we have existing GE machines. But this, if we can get the two MRIs upgraded, plus have the new CT installed, plus the ultrasounds, will really give us a big reload in diagnostic imaging.
Just from the community, hearing some people talk about our ultrasounds, really encourage the work to progress swiftly on them, if possible, and the sooner the better. And the same thing for the MRI. I think standardization always ought to be there. If we can get that done, it just is another cog that helps everything flows more smoothly.
Yeah, the we're gonna work really hard on it the next few weeks, and December 2nd, if we can negotiate a deal, we'll introduce it for the board for action, and then we'll bring it back to the budget committee, and then full board on December 16th. But I think I agree with you, Jim, that it's an important purchase, and it will move us forward where we need to be. We need some areas we need to address. So any questions for me? Dr. Kennedy's on vacation and Julie couldn't make it, so you probably saw more of me tonight than you're used to seeing. But just that time of year, I guess.
Did a good job, thank you.
I tried.
Yeah.
Thank you.
Thank you, Eric. This concludes our regular session. After a 10-minute recess, the board will meet in executive session to discuss current or potential litigation by authority of RCW 42.30.110. No action will be taken, and this executive session will last approximately 15 minutes. We are. Favor?
Aye.
Those opposed? So moved.
Great, thank you.
Thank you, Dr. Corley.
I would also like to introduce the contract for Jennifer Hunter. She is an ARNP who is a recent graduate of Seattle University. I will bring you more information at the next meeting. She will be joining the pulmonary team as an ARNP, and this will be for a base salary of $90,000. Thank you.
Thank you. I don't think there's anybody in the public sheet, Jane. Okay. Next up is old business. Eric Lewis, Chief Executive Officer, 2016 to 2018 strategic plan.
Well, good evening. Tonight I want to bring forward for board consideration the 2016-2018 strategic plan. We introduced that at the last board meeting, November 4th. We only have one change since then. And the one change we have is on page 1, the board letter to the community. Under our vision, the third paragraph, the first part stays the same, where it says the community will benefit from Olympic Medical Center's local focus as it addresses the healthcare needs of our citizens. And then we changed it a little bit to add the triple aim, where it says, through focusing on the triple aim of improving individual patient experiences, improving our community's health while maintaining financial stewardship. And I think the triple aim is the governor's plan for the state, and we've long talked about improving individual patient care.
Have drug issues, so it was really delightful to hear some really nice things about a physician that you've met and really enjoyed. So she interviewed here about a month ago, and everyone who met her loved her. I believe an ad that her husband and son went swimming in Lake Crescent in late October. This is she would not be able to join us until the summer of 2016 because, as I say, she's finishing her residency. This is our standard physician employment contract. It is for a base salary of $308,368. It does include a $12,500 fellowship stipend, and then a $12,500 signing bonus when she completes all her paperwork. It includes our standard benefits, CME of $4,000, and then a retention of $10,000 a year for 4 years.
May I please have a motion to approve the OMP OBGYN physician employment agreement for Oksana Shalanka, MD, at the annual salary of $308,368 as presented.
So moved.
Second.
Comments or discussion from the board? All those in favor?
Aye.
Chip, or she will have, because her husband is an American.
Can you repeat that, please, Jim?
She is a U.S. citizen.
Thank you.
Yeah, she's a U.S. citizen right now.
Other comments from the board or discussion? All those in favor?
Be 5-10 years from now. And I thought that was very key work. The big new goals we have a total of 29 goals. The new goals that are they're, I think, pretty big is one is we're implementing a quality management system. And this will use ISO 9001 through DMV. We'll be certified by 2017. That is a big goal. We've been working on it rather extensively the last 6-7 months, but we're going to keep working on it through 2016. We also have added a goal on becoming DMV infection prevention and control certified by the end of 2017. It's a 2-year process to become certified. We are working on it now. This will affect every department at Olympic Medical Center. It will affect our medical staff and just making sure we're having the best practices, the best processes on infection prevention and control. So I think that's a very good goal. We'll also be evaluating whether Olympic Medical Center should become a 49-bed sole community hospital with rural health clinics. That'll be evaluated over the next 6 months. We'll come back to the board with a formal report. We also are going to be implementing Honoring Choices Pacific Northwest. OMC is one of 30 hospitals receiving a grant. And what this is it's an advanced care planning program where people make their they do advanced directives, they make their wishes known, and get those documented on an advanced directive. We're going to be doing that in 2016 at all of our clinics. A lot of education, a lot of process improvement.
First item on tonight's agenda is the consent agenda. May I please have a motion to approve the consent agenda as presented?
So moved.
Comments or discussion from the board? All those in favor?
Aye.
Those opposed? So moved. Olympic Medical Physicians Report, Dr. Corley.
Good evening. I'm here to request approval of the physician employment contract for an OBGYN physician, Oksana Shalanka, MD. Oksana was raised in the Ukraine. She practiced OBGYN there as a physician for 10 years before meeting her American citizen husband and moved here to the United States with him. She then turned around and repeated a 4-year OBGYN training program in order to practice medicine in this country, and she's currently in her 4th year. She's at New York Medical College back in New Jersey. No wonder she wants to move to the West Coast. I talked to one of her attendings this morning, and she described her as one of the best residents they'd ever seen. And she's the person that if anyone needed extra help or to stay late in the evening to help out with something, she was the person that would volunteer to do that. She also described her as having a special talent of working with the difficult pregnant women that may be runaways and on the street, or
They're improving population health and controlling per capita spending. So I think the board strategic planning committee was comfortable adding that one little phrase. So that's the only change from what you saw 2 weeks ago. I will say that this is a living document. This is a document that we use every day. I carry it around with me, and as we make decisions, it does drive our decisions and how I try to spend my time and other people in the organization spend their time. We update it at least annually, but the board can update it more often if necessary. And I think the environment we're in healthcare, we have to be ready to change our strategic plan if the rules change in DC or Olympia. I do want to recognize, the entire board involvement in this. The board is really involved in strategic planning, which is very helpful. The board strategic planning committee spent a lot of time. That's Commissioners Oblock, Commissioner Hordijk, and Commissioner Beitzel. All three spent a lot of time on this. Bobby Beeman helped us with drafting. And alt, employees, medical staff. We had medical staff meetings in both Sequim and Port Angeles. And public input. Really, it all comes together in these changes. And I will say, probably one of the biggest changes we made this year is the first page, the board's letter to the community. We talk about our core values of quality, teamwork, compassion, respect, integrity, and stewardship. We give a little bit of an explanation on each one, which I think is very helpful. We also updated our vision on where we're going, where we want to be.